We are still going to wear face masks, face shields, maintain social distance, and practice good hygiene even after vaccination. Please keep that in mind. I'm going to share a private recorded discussion with my friends last August to refresh us again with the basic health concepts that will keep us safe.
Okay, we are live now. Doc Omar, okay na
Okay,
tayo? Yes.
yes. Good day to all. Do you recognize this lady in the picture? She is Marie Curie, a scientist, a wife, and a mother. She discovered radioactivity, the elements polonium and radium particularly. She's the first woman to win a Nobel Prize, and not only one but two at different times. I was Googling a certain word or adjective a couple of weeks ago, and I remember it was used to describe how Marie Curie discovered radioactivity. And I came across with this quote coming from her. Nothing in life is to be feared, it is only to be understood. Now is the time to understand more so that we may fear less. Now, let's talk about COVID-19 and let's learn something from it. Our objectives for today is to become more knowledgeable about the disease, to learn how to prevent the spread of the disease, and to allay the fear and anxiety among us. Infection, it is basically the interaction of an infective agent with a suitable host, resulting to a disease and injury. We have several infectious agents, and they are classified into two groups, the living and the non-living. So living infectious agents includes parasites, protozoans, fungi, the prokaryotes, example are bacteria. And for the non-living group, we have the viruses and the prion. So what is a virus? As you can see in this diagram, in this picture, they come in different forms and shapes. And they are submicroscopic, non-living, and all of them contains a genetic code, but they need a live host, a live cell, in order for them to replicate. So this is the viral structure. It is also divided into two classes or groups. We have naked viruses and we have the envelope viruses. So the difference is there's an additional membrane or layer surrounding the core of the viral structure. So it has an envelope. So this picture depicts the electron microscope image of coronavirus. So as you can see, the shape is round, and you can see some projections around it. And basically, it looks like a crown. So that's why they called it coronavirus. So the 2019 coronavirus, as we now know, it's the 2019 nCoV. So usually we millennials like to abbreviate. But scientifically, it's known as the SARS-CoV-2 or the severe acute respiratory syndrome coronavirus 2. So the infection is called the coronavirus disease 2019 or COVID-19. So that's the disease, and the infective agent is the 2019 nCoV or the SARS-CoV-2. So the virus was first identified in China in this seafood wet market in 2019 of December. Origins are not fully understood. Some say that they came from pangolins, some say they came from snakes, but mostly tell us that they could have come from bats, since bats contain or has the virus. Around more than 60 strains of coronaviruses can be found in bats. And look at this bat, he's laughing because I think that the novel coronavirus did came from bats because people are becoming panicky. So for its genetic code, you can see the difference between an RNA and then a DNA. So the DNA has two strands facing each other, covering the code, while the RNA is one strand only. So the coronavirus or the SARS-CoV-2 is a single-stranded RNA virus. So the advantage of this, it doesn't need to be split into two to have the codes available. So it's already open. It's readily available for uh, decoding and encoding and transferring the information and converting it into proteins needed to form another virus. So its shape is spherical with an average diameter of 125 nanometers, and it has a club-shaped spike projections emanating from its surface, as you have previously seen on the electron microscope image a while ago. So those are the projections. It is also an envelope virus, and the nucleic acid and the nucleocapsid protein are found underneath a lipid bilayer. It belongs to the bad family of coronaviruses. And in general, coronaviruses are relatively big viruses compared to other RNA viruses. And they have an advantage of a genomic proofreading mechanism. So what does this mean? They have the ability to check what is being processed uh, in decoding and encoding information. When they see a mistake, they immediately stop the process and cut it out. Another advantage of this group of viruses, they frequently recombine. So what's recombination? So in a living host or a cell, when two strains of coronaviruses enter it, two viruses may have two different codes or genetic codes in them. When they create another genetic code, they can mix a code coming from one virus and a code from another virus. So that's another advantage of this group. And they can infect many cell types, but mainly they cause respiratory infections. There are 7 identified viruses that infect humans. So 4 of these viruses that infect humans mostly affect the upper respiratory tract. The other 2 affects the lower respiratory tracts, and these are the SARS-CoV, the one that we had, I think, early 2000, and the MERS-CoV. And the 7th coronavirus that infects humans is the SARS-CoV-2. The SARS-CoV-2 can infect the upper respiratory tract and also the lower respiratory tract. So this is the life cycle of a virus. Basically, a virus initiates contact and attaches to a cell, and then it penetrates it. Once inside a living cell, it can open up itself to release its genetic information or material, and taps on the mechanism of the host cell to produce another virus. Then eventually it will expel it. The host cell will expel it. It will either uh, maintain the cell living, or it can damage totally the host cell. So this is what happens. This is a slow motion of a man sneezing. We can see the trajectory of the saliva, and it will probably contain a lot of germs. And initially it will float around. And once they contacted a living host cell, it will enter it and perform to transfer its information to the host. So basically, in a way, it overrides it. So the code, the messenger RNA, gives it to the ribosome. The ribosome creates the protein, and these are the what's needed in a virus, in a new virus. So then it goes out of the cell. So in summary, basically it looks like this. So the virus enters the cell, goes inside, and multiply. So I have come across 2 studies, and people are alarmed by this. Uh, the Business Insider beautifully summarized the 2 studies. They combined information coming from these studies, and it shows that coronavirus can live on surfaces, and it range from 3 hours to up to 7 days. But we should know that these studies were conducted under a controlled environment. So for these studies, it ranges around 21 to 23, or roughly around 22 degrees centigrade or Celsius, and at a relative humidity of 40 to 65. So how does the disease spread? There's a mathematical equation, and there's a mathematical term, the R naught. The R naught is the mathematical estimate of the number of people who will catch a disease from one contagious person. So comparing it from a flu, COVID is more contagious. On this slide, you can see it's around 2 to 2.5 persons. One infected person can infect another 2 to 2.5. But I've seen some studies, they claim that it can go as high as 4 people. And then how long until you see symptoms? For COVID-19, symptoms may appear after 2 days to 14 days. And how many people get hospitalized? Around 19%. How many people die? Studies have shown around 1% to 3.4% for COVID-19. Sometime in the early time when we are being invaded by this virus, I think we reach around 6%. And arriving at this number will greatly depend on the testing. So if you only tested a few people, it will really get high. So these are the symptoms of coronavirus. So fever or chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. So come to think of it, it's almost similar to other respiratory tract infection or any kind of mild infections. So it's really hard to tell. So let's define things first. So incubation period. This is the period between the infection of an individual by a pathogen and the manifestation of the illness of the disease it causes. So it's the time from first contact, your contact with the infectious agent, and the start of symptoms. Symptom, what is a symptom? It's the change in the body or mind which indicates that a disease is present. Symptomatic, so a person with symptoms. Asymptomatic, a person without symptoms. Pre-symptomatic, before the symptoms appear. And viral shedding, this is the expulsion and release of virus progeny following successful reproduction during a host cell infection. So how do we transfer it? How do we get infected? It's mostly person to person through respiratory droplet spread, by talking, sneezing, coughing, by close contact, and fomites. So fomites are objects where microorganisms or infective agents can stay. And most of the time, it's always in contact with our hands. And hand to mucous membrane transfer. So the virus is inhaled, and port of entries in current studies are nose, mouth, and eyes. And mainly the concentration of the virus is in the nasopharynx. Based on studies, the virus is also present in asymptomatics and pre-symptomatics. One study found that as many as 13% of swab tested, so PCR swabbing, confirmed 13% of children were asymptomatic. There's an increasing numbers of epidemiologic studies documenting that SARS-CoV-2 transmission happens during the pre-symptomatic incubation period. The relationship between SARS-CoV-2 viral RNA shedding and transmission risk is not yet clear, and the proportion of SARS-CoV-2 transmission due to asymptomatic or pre-symptomatic infection compared to symptomatic infection is unclear at the moment. For the illness severity, we classified it into 3 groups, and it is demonstrated in this pie. And as you can see, most of the patients will have mild to moderate symptoms. It's more than 80%, around 81. I've seen studies that claims that up to 90%. So what are the risk factors? So age and comorbidities. As the age increases, the severity or the chances of getting a severe disease is higher. And also, if you have other underlying medical conditions seen in this slide, it increases your chance of getting a severe illness, but not all the time. For people having no comorbidities, it's around a little more of 1%, but if you have comorbidities, it's 10.5%. And the study also tells us that hypertension alone is not considered to put a person to a higher risk of severe illness. So it's mostly a combination, hypertension with diabetes, hypertension with chronic respiratory disease. So that will make it give you a higher risk to get a severe illness. So what are the things to consider? So viral RNA shedding declines with resolution of symptoms, and it may continue for days to weeks. The detection of RNA during recovery period does not necessarily indicate the presence of a viable infectious virus. So the virus contains the RNA. So the PCR testing will detect the RNA. So it can happen that the RNA is still present, but there is no virus or no complete structure present in a person. So it is possible to say that you can get a positive swab result after 2 weeks, after 3 weeks, after 4 weeks, but it may not be, or the patient may not be considered as infectious anymore. And clinical infection has been correlated with the detection of IgM and IgG antibodies. So the antibodies are present in the blood, and these are the ones being detected in the rapid test kits. So the IgM indicates an acute infection, while the IgG indicates a recovery from an infection. So ang aking tinuturo para mas madaling maintindihan, IgM makakahawa, M makakahawa, and IgG, G gumaling na. But test may also, the rapid test may also give a combination of results. So pwedeng interpret din na makakahawa pero gumagaling na. So if you get a test result, IgM positive, IgG positive, so maybe you're in the limbo in between. So still have the infection but recovering. Also, the viral load and exposure time are crucial for successful infection. And temperature and humidity have effects on viral stability and viability. But it remains uncertain whether individuals with antibodies are protected against reinfection with SARS-CoV-2. And if so, it is still in question whether what concentration of antibodies is needed to give protection. So what do we need to do